We're going to have our two guest speakers a little later on, but first I'm going to reintroduce Dr. John Carmichael, who's going to talk to us about the etiology and diagnosis of hypopituitarism. John.
All right, so before I begin my talk, I want to thank a few more people. The program like this really could not happen without the support of a lot of our colleagues out there from the pharma industry, and so I want to thank all the exhibitors and thank the people who have provided grants. Corcept, Pfizer, Strongbridge, and Medtronic provided grants for us this year, and really they're very helpful in providing educational programs like this. So I really want to thank them. I also want to point out that in the next few weeks, there's going to be a thyroid symposium, and maybe some of you are familiar with this. It's been going on for several years. Dr. Singer is hosting this. This is going to be at USC on June 3rd in the Mayer Auditorium, in a different auditorium than here. Dr. Singer has been instrumental in helping me with the planning of this symposium. Has been a good role model for how to do events like these. So I want to thank him and really promote his symposium. Not that he needs it. It's been, I think this is we're coming near the 40th one. He couldn't be here today because I think he's at his, might be his 20th high school reunion. I'm glad some of you got that. All right, and I want to make just one quick note. I started going into pituitary medicine about 15 years ago now at NYU. And if it weren't for my mentor, David Kleinberg, really would not be here today. He passed away in January, and it was a significant loss to the pituitary community. It was an instrumental part of the Pituitary Society and really helped foster my career. And so I want to just take a moment to acknowledge him and all of the help that he's given to me over the years for my career. I'm going to be talking right now about the etiology and diagnosis of hypopituitarism. This is something that I got interested in right away. One of the first papers that I did publish was on IGF-1 in the healthy elderly, and we looked at IGF-1 just on 2 separate days without any intervention and saw a huge variation in the assays. And so I immediately, at the very beginning of my fellowship, got involved in thinking about diagnostic testing. We already had our pituitary review, but this is just to, again, emphasize that negative feedback that's so important in both the secretion and the diagnosis of pituitary disease. And again, we see that ACTH, TSH, LH, and